I think people should know that we are seeing, not starting, it's been going on for a couple of weeks now. We're seeing that COVID cases are rising, actually throughout the US and also here in Fulton County. However, what I have to say is that while the COVID cases are rising, we don't have the same the same numbers that we had before. One thing is that most people are testing with rapid tests, and those are not reported to us, so we really don't know the number of cases that people might have diagnosed at home. However, we definitely know they're rising because of the fact that we are seeing more PCR tests that are being reported to us, and than we have been seeing in the past few weeks. And our wastewater surveillance has been showing more COVID. So we are definitely seeing a rise in cases. That said, it's important to know that the rise in cases that we're seeing now is a lot less than it's been in each of the prior years before this. So, which is very reassuring, possibly related to the fact that many people have been vaccinated and many people have had prior infections. So there's certainly a higher level of immunity around. So I guess the take-home message is we are seeing a rise in cases, but it has not yet reached the level that we've dealt with in prior years. One is that I should mention that the new variant that is circulating is different and has a lot of mutations in it, but at least as of this point, it seems to be about as transmissible and to be to have about the same morbidity as prior variants. So it doesn't seem to be a more dangerous virus. However, again, as I mentioned, it has different mutations. What is going to be available to all of us in about 3 weeks, somewhere around mid-September, a new vaccine, a new booster for this vaccine is going to be released, which is much better tailored to the current circulating strains. And so what we are advising people to do is very simple. The most important thing one can do is to get vaccinated. And so as soon as the vaccine is available, you should go ahead and get it, because any immunity tends to wane over time. So immunity gained in the past, either from the prior vaccination or from natural infection, we do know that wanes. So that's why it's incredibly important to get this new vaccine when it comes out. And of course, the preventive measures still work very well. And that includes, of course, masks, preferably the higher quality masks like the N95s or the KN94s. Obviously, testing is important, and we want to make sure that people know that they can get tested at any of the Board of Health clinics. You can also obtain rapid tests that you take home with you at these clinics. In addition, you can get them at many of the public libraries in Fulton County. So it's worthwhile to call and see if they have them in stock and go and pick some up. And of course, we still have you can still get PCR tests at several different locations in Fulton. In Fulton, and if you go to our website, which is simply fultoncountyboh.com, you can get a list of all of these resources and also links to be able to register for the testing. Now, people also ask is that what should they do if right now they're having symptoms, or if they have been told that they have been around somebody who has tested positive. And so the recommendations, again, have not really changed much from what they have been over the past year. If you have symptoms right now, go get tested. That is very important. And most importantly, stay home. Don't go to work. Don't be a hero. If you got some symptoms, make sure that you go home and you get tested as soon as you can. If you are positive, then you will the recommendations that you should isolate at home for about 5 days, assuming then that your symptoms are better. They don't have to be gone, but as long as they're improving, you can go out after those 5 days, as long as you wear a high quality like N95 mask. And those are the standard recommendations for someone who tests positive for COVID. If you are somebody who just knows that you have been around somebody who has had COVID, and therefore you are what we call a contact, then what we tell you to do is that you should wear a mask. If you have any symptoms, you should test. But assuming that you've just been around a contact, you have no symptoms, we say that you can go about your business, your usual stuff, but we recommend that you wear a mask, for a good quality mask, for about 10 days. The best thing to do is then to test yourself somewhere between 3 and 7 days. So about 5 days, after the last time you were exposed, you should get a test and see whether or not you have turned positive yourself. We recommend that you continue wearing this mask for about 10 days, because the likelihood of you turning positive after 10 days after an exposure is very low. So you can stop wearing the mask after about 10 days. Or if you want to stop masking earlier, if you get, after that 5-day period, if you have 2 rapid tests over a 24-hour period that are both negative, then you can go ahead and take off your mask, because it's unlikely that you're going to become positive. So that was very long-winded, but that's sort of what should you do in the case of you're either being positive yourself or being told that you've been exposed to somebody positive. Well, the most important thing is, remember, vaccines work. So the best thing you can do is to get vaccinated. So you can get, as I mentioned, around mid-September, we will have the new COVID vaccine available. So you should get vaccinated with that as soon as you can. In addition, the regular flu season is coming upon us. And our recommendation is that people should, start looking to get vaccinated somewhere between, anywhere starting in September and October, because that's usually when, in prior years, the best time to get vaccinated. There's been a new recommendation out from the CDC that if you are older than 60, then you should probably talk to your healthcare provider about whether or not you should get the RSV vaccine. It's a 1-dose shot, and it's been shown to be very, effective against RSV in older people. RSV is very common. It is, most people have had RSV, particularly when they're younger. But again, it's one of those things that has a much harder effect on you when you're older. And so it is recommended that you talk to your doctor about getting the RSV vaccine as well, if you are over 60. So the most important thing is get vaccinated. Get vaccinated, do that. If you're in a situation where you feel that there might be people around, you don't know whether or not they might have COVID or the flu and all that, you lose nothing by putting a mask on. Masks do work. They are protective. They're protective if you happen to be infected. It prevents you from passing on, and it's protective if you're around people who might be infected. So have a low threshold for putting that mask on. And what I would also recommend to everyone is that just check our website from time to time. It's FultonCountyBOH.com. There's a lot of information up there. We put up, latest COVID news. We talk about where you can get vaccines. And so I think that you would find it to be a very useful resource, and I would encourage everyone to use it.